Hello, my name is Michael Villanueva, and I am the clinical psychologist here at the Alpha Theta Center in San Diego, California. We've been doing more work these past couple years, as I'm sure other centers have, in the area of aging, people coming to us that are older, worried about memory, cognitive decline. Is this dementia? Do I have dementia? So this issue of aging has come up a lot. And it's caused us to think about aging. What makes for healthy aging? What makes for unhealthy aging? I remember when I was younger, I was always struck by the fact that we're very good at labeling pathology in the brain, but we really aren't good at labeling healthy behaviors in the brain. In fact, I don't think we know what makes for a healthy brain. So it causes us to think, well, as we age, must we slow down? Will we always have memory loss? We know that's not true. We know that people age and some very elderly folks are very much focused and have cognitive skills and have great memory. Some of them smoke 14 packs a day or whatnot. But for here, we and other folks that provide services think about the signs of dementia and what are the early warning signs? Because this is what we get asked a lot. Do I have dementia? I'm starting to slow down. I'm forgetful of things. Can you tell me if I have dementia or not? So there are signs of dementia. Unfortunately, a lot of signs of dementia in the elderly are exactly the same signs as we see in depression. In fact, in my graduate training, the professors were very good to train us. Do not mistake depression in the elderly for dementia. They can overlap, and there's some. If you find yourself putting your iron away in the freezer, that's not a good sign. But if you can't remember where you put your iron, or you can't remember if you turned the iron off or on, that's kind of more in the line of normal stuff. So it also causes us to think, if men and women's brains, do they age differently? They do, and there's some really good normative data out there. We do a lot of EEG work here, and the South Koreans have a phenomenal database that really signifies differences in men and women as they age, and maybe we can do a video on that at some other point. But here at the Alpha Theta Center, we work very hard, and more so it seems as the years roll by, to place clinical work that we do and place our assumptions within a scientific context. It's very easy in the, quote, brain training community these days, or brain hacking, to come up with a lot of cockamamie, quote unquote, protocols, well, if you do this and do that, or take this supplement, it does this and that. And all those things may be true because we are on the fringes of science. And any good science is in a state of flux, because after it's no longer a state of flux, then it becomes known and verified zone. And we have to realize there are some things we can change and some things we can't. So we talk about the myths here at the Alpha Theta Center. We know that aging doesn't always have to be pathological, and we work hard to make sure what we do is in line with current neuroscience. And so what we get asked here is, well, what can you do for me? And that's easier to answer. What we can do is we can map your brain, and that's almost become a euphemism in our culture. So what does that mean? You put a cap on somebody's head, and you have anywhere from 19 to, if you're a research center, to 256 plus electrodes. And you gel them up, and you run impedance check, and you measure the scalp surface electrical activity. In mapping the brain, the value of that is knowing your inherent strengths, weaknesses, and deficits. It's not a pathology hunt. No more than taking a picture of a Grand Canyon is a pathology hunt. It's just simply a snapshot of what the surface electrical activity is showing us at this time. And it's extraordinarily valuable, because if you really are forgetting where you put your keys, how to tie a tie, oh, what was the name of her name? Where was I supposed to be? It's really nice to know if there's something fundamentally going on in the memory centers, or if it's, in all likelihood, as we age, frankly, 90% of the time, it's related to poor sleep. And we can help you sort those symptoms out. We can put your mind at ease between that type of normal kind of forgetfulness of stress life, and maybe the forgetfulness associated with the intense grief and or depression of losing somebody, and the type of forgetfulness and lack of organization and kind of emotional outbursts that can be associated with dementia, notably Alzheimer's. We provide other services as well. We can provide neurofeedback. There's other resources that we have available, and we can also provide services for a very much overlooked population within the aging group, and those are the caretakers who take care of the elderly. Those people oftentimes have zero to no training, and it is a very, very difficult job, and we understand that as we have worked with caretakers before. So if you have questions about aging, what makes for healthy or unhealthy aging, or want to learn more about our services, please give us a call here at the Alpha Theta Center, and thank you very much for watching this short video. Thanks.